So PGD stands for preimplantation genetic diagnosis, and that name has been used for many years to define the testing of the embryos before implantation, so before a pregnancy has been established. And it has been a very good option for many years to prevent genetic disease, and a very good option instead of the more traditional prenatal testing, which is done after the patient is already pregnant by testing the baby with either CVS or amniocentesis. So the benefit of doing the testing before implantation is that you can test the embryos and only implant into the mother the ones that are healthy to testing. And depending what we're testing for, we have a different type of PGT. One of the most popular forms of testing is now called PGT-A. So instead of PGD, preimplantation genetic diagnosis, now all this genetic testing is called PGT, which stands for preimplantation genetic testing. So the percentage of embryos that have errors in their chromosomes increases significantly with advanced maternal age, especially after the age of 35. So these embryos that are abnormal will look the same as any other embryo. So you can't tell by looking under the microscope if they're genetically okay or not. So with PGT-A allows the IVF lab to select the embryos that have the highest chance of implanting and making a healthy baby. Abnormal embryos will either not implant or result in a miscarriage. So the other advantage of using PGT-A is that it allows us to implant just one embryo. Before, we used to transfer a larger number of embryos, especially in older patients, to compensate for the lot of abnormal embryos that we know are going to be there in the pool. So by doing the PGT-A, the lab is able to select one normal embryo with the best chance of implanting. The most recent studies show that this could be especially beneficial for women over the age of 35, which is when the proportion of abnormal embryos starts going up.